Everyone, it's Pete here and Pete Moore. I'm with a really good friend of mine called Joe Joletta Belton. Hey, Joe, how are you today?
I'm good, Pete. Thanks so
Yeah.
much for having me.
Well, I'll tell you what, I'm really pleased that you're going to come on and do this session with me. And this session is about for the British school, British Pain Society, their ASM, and they asked me to do a session on global or supportive self-management from a global perspective. And I thought, hey ho, what the best person to get on board with this is you yourself, like because of your involvement with an organisation called GAPA. But before we get into that, Joe, I thought it would be useful. You know, I mean, over the years, the term self-management has been used time and time again, but I'll be honest with you. I got pulled up by our very good friend Keith Meldrum over there in Canada. He, when we was doing some work together back last year, and he was saying that really there's this other term, supportive self-management, and he described it's because people, when you say to someone about being we need to self-manage, for a lot of people was thinking that they're being cut loose and they've got to do their own thing and whatnot. And then I was thinking, so well, do they really and everything? Anyway, do you know what? I did a bit of I was having a cup of tea in bed, and one Sunday morning, and I thought, well, let's find out where this supportive self-management, what's going on here. And do you know what? I was really surprised. I put in here supportive self-management, and a website come up from the NHS, the National Health Service. And do you know what? There's a whole bundle of information there about supportive self-management. I said to myself, hey, Pete, you've got to have to get out a bit more. So, I mean, what's your take on it, Joe? I mean, for people with persistent pain, do you think, this term supportive self-management, we really need to push that now?
Yeah, I really like the term supported self-management because I agree with Keith that a lot of people, when they're told about self-management, feel like they're being abandoned by their healthcare providers. Like they're just told there's nothing more that can be done. So you're on your own. You're just going to have to learn to live with it. So I think sometimes with the messaging that we receive, we kind of feel like we're being left to our own, devices. But when we're supported, whether that's by the healthcare system or by peers, and ideally both, then there isn't that sense of abandonment. And I know for myself, I've been living with pain now for 11 years. I do need support for my self-management. And I rely on my peers and healthcare professionals to remind me sometimes of those things that I know that I can do to help with my pain and to help manage not just my pain, but my life around that pain too. So that idea of support, I think, really resonates with me. And it was a new term for me too in this last year. But I really like it. And I think that if self-management is to be a regular form of care, which I strongly push for, it being supported by healthcare systems and by peers is really important as well.
Yeah, I mean, I say so. We're sort of digging it. We're getting on with it and accepted it, and it's a good term, etc. But what about our friends out there in healthcare professional land? Do you think that I'm a big fan of getting supportive self-management in the med schools, instead of healthcare professional coming out sort of, with half the knowledge sort of thing, do you think we need to be getting more involved in the medical schools so that they're actually teaching supportive self-management while healthcare professionals are going through their respective schools?
Definitely. And I know you and I have had this conversation a number of times. No matter who we are and no matter what treatments we're going through for our pain, we are always living with our pain the majority of the time on our own. We're living our lives in the real world mostly on our own. So we all need to manage no matter what treatments we're undergoing. And we're either going to manage well or we're going to manage poorly. And I know a lot of us managed poorly for a really long time before we kind of discovered self-management and peer support and these things. So I think that the earlier in the process we as people living with pain can learn this information, the better. And we can only learn that, I think, through healthcare professionals. If across the board, all healthcare professionals who are working with people living with pain have this information and are trained in this information, it will be better for all of us. And that this supported self-management is such a beneficial adjunct to whatever other therapies we might be undergoing for our pain.
I know there are some schools out there who are including it. I remember, I think our other good friend, Bonnie Thompson down there in New Zealand, her university where she teaches, that they've included supported self-management within their learning modules. So, hey, you know, we can only keep our fingers crossed, and hopefully that, you know, the penny drops with them, that instead of you know, people having to learn this stuff on the job, that they
Right.
learn it in med schools, etc. Funny enough, I'm running a poll today about you know, when should the healthcare professionals you know, be taught about supported self-management, and I'll give them, you know, three options really. You know, while in med school, 1 or 2 years after med school, or while on the job. And you know, the way out in front throughout the day, it's been while they're in med school, like, so it's just not us, it's others out there as well. But I'll tell you what, I'm really excited, and I think for those watching this video, I think what would be really interesting to know, because you know, self-management, we're trying to get at in a global sort of sense, and I know the fantastic work that you're doing over there with IASP, the International Association for Study of Pain, under an umbrella of an organisation that they've helped set up called GAPA. So can you tell the viewers what GAPA is, how it works, etc.?
Yeah, absolutely. And thanks so much for that. So GAPA stands for the Global Alliance of Partners for Pain Advocacy. And it is currently a task force of IASP that is made up half of people who are living with pain or are advocates in some way for people living with pain. And then the other half is IASP's traditional membership. So the clinicians and researchers that make up that traditional membership. And we are all coming together to figure out ways to integrate that lived experience knowledge that people living with pain have into all aspects of achieving IASP's mission, you know, improving outcomes in awareness, in understanding and research, teaching, assessment, and management of pain, through this kind of collaborative spirit of bringing all of those people together. And part of that is around, you know, including people living with pain on research teams, and then also stressing things like peer support and self-management, which I feel like are really interlinked, because I feel like we learn a lot from each other. So if peer support can also be supported alongside self-management, I know that that's something that we are going to be pushing for and providing training for in the future, being, like you said, kind of this global organization, this umbrella where we can bring together all of the amazing work that's already been done or is being done around the world in this space into one place, so that people have somewhere they can go to learn more about how to work with patient partners or people living with pain in all of these different areas. I
know, I'll tell you what I'm really impressed with is it is a global effort, really, because the members of your group are literally from all around the planet, you know, for Asia, South America, North America, Europe, Australia, yes, New Zealand, etc. Like, you know, it's fantastic. I mean, fantastic.
Scheduling meetings is difficult because I think we span 17 time zones, which is a lot of time zones. But it really demonstrates how global this organization is. And that's really exciting, because we need to be able to provide materials and support and training that can be used for any person living with pain, or a person who is treating pain or researching pain around the world.
But I know you've probably got things planned over. I know everything's, because of COVID-19, everything's online now. But so I'm taking it that all your meetings are at the moment are remote, you know, or virtual, you know, like what we're doing today. But in the next IASP Congress. I think it's in Canada, isn't it? I think from memory.
Yep, it'll
Yeah.
be in Toronto in 2022.
Fantastic. So I'm taking it that one's hopefully with COVID things, it's all calmed down a little bit more. So will that be a face-to-face effort?
Yes, we are hoping so. At this point in time, we are hoping so. As you know, the 2020 World Congress all was postponed, and then it moved virtually, which will be happening in June of this year. But we're hoping to all come together again. So I know when we met in Boston, that was such a being able to come together, having people living with pain come together, the advocates in this space come together is such a meaningful experience for all of us that I really hope that that's a face-to-face meeting. We're also having a conference, a virtual conference at the end of this year for GAPA that is for people living with pain and pain advocates to learn more about what all of this looks like, because it's the task force right now, but we're going to become an organization. So as we do that, we want to expand our reach and our membership and our connections and collaborations around the world.
So you've got your, I'm just trying to visualize that. So you've got your setup with all your, I don't want to call them officers, but what would you, the core members, but are you, will it be opened up to people with pain from around the world, etc.? They can join as like a, not associate, I guess associate member or something. Is that right?
Yes. Yep, that's how it will be. So people can join as individual pain advocates or organizations, pain advocacy organizations will be able to join, as well as IASP traditional members, clinicians, and researchers, because we really want to emphasize that collaborative spirit and that co-creation of materials and education and research and learning. I think when we all come together to develop this, the better it is for everybody, and the more innovative solutions we come up with, and the more barriers we can identify and overcome in that process.
Hey Joe, I'll tell you what, baby, this is you know, I think this is awesome, the work you're doing there, because this is something I visualized some years ago, like, you know, that we have to get out there and be global. And I think that the Blue Touch paper was when we met over there in Boston in, was it 2009, 18, was it?
18, yep.
Yeah, and we all met up and everything. And although we knew each other from social media, etc., but to actually meet up and that face-to-face core stuff, you know, I think that's what lit the Blue Touch paper.
Yeah.
So listen,
I think that was, sorry, Pete, I was going to say, that was the real catalyst for all of this amazing work I think that's been done in the last 2+ years. And it's really exciting, and we'll be able to spread the pain toolkit and supported self-management idea around the globe, and that's really exciting.
Okay, listen, Joe, listen, I always think, you know, we're going to finish up now, because I know we can't be there. I know this is going out, they're having a live session. And by the way, if you've got any questions for myself and Joe, just post them to the British Pain Society, and I'm sure they will pass them on to myself and well, your good self and me, and we can email back with replies to any questions. But Joe, what's a final take-home message for people out there who are interested about supportive self-management?
I think I know I've already said it, but it's really that idea that we all have to manage every day, whether we're living with pain or not. We have to manage our lives. And when we're living with pain, that can be more difficult. And so supported self-management is so important, because we want to enable people to do that as best they can. We want them to be able to live as well as possible with their pain, because they're going to be managing one way or the other. So to help them manage better should be a goal for all of us.
Well, thanks very much, Joe. And listen, guys, thanks very much for watching us on this video. Sorry we couldn't be with you, but my take-home message from me anyway, you know, about this self-management business is that I know if I can do it, then I know other people can as well. But listen, you've got to give us the opportunity. You know, this medical model that you're all working in some areas, you know, it keeps us in the passenger seat, and we need to be in the driving seat, where we can get on with this self-management living, etc. So again, thanks very much, Joe. I'll see you again soon. And again, thanks for everybody for tuning in. And wherever you are in our planet watching this or in the UK, take care. Have a good afternoon. Ciao.